Hello, Professor. This is my presentation for topic 6, DQ2. I'll share my screen to explain my codes. For this topic, the real world situation could be in the field of medicine, where research could be conducted for a study to compare the effectiveness of 3 different treatments for a specific medical condition. The problem could be addressed for this scenario would be to determine the most effective treatment for a specific chronic medical condition like high blood pressure, and the comparison between 3 different treatments such as treatment A, B, and C. The data will be collected from patients before and after treatment. The research question, the primary research question in this case, could be about the effectiveness of the 3 treatments and their impact on patients' health. For paired data analysis, the research question is, does each treatment lead to statistically significant improvement or deterioration in health measures compared to the baseline? For multiple population means comparison, the research question, is, are there statistically significant differences in the mean improvement among the 3 treatment groups? For variance comparison, the research question is the variability in health measures significantly different among the 3 research groups? Now, the appropriate statistical test with the explanation is that for paired data, the appropriate statistical test would be the paired t-test. Since paired t-test is suitable for comparing the means of 2 related groups, such as the health measures before and after each treatment for each patient. For multiple population means, the appropriate statistical test would be the analysis of variance ANOVA, since it is suitable for comparing means across 3 or more independent groups. In this case, it determines if there are statistically significant differences in the mean improvement among the 3 treatment groups. The variance comparison has the appropriate statistical test, which would be the Levine's test for homogeneity of variances. Since the Levine's test assesses whether the variances are equal across different groups. Now, the test here, I performed the test here. I generated some data, and I use the treatment group, treatment A, for the paired analysis. For the multiple population means, I use the F-stats, the ANOVA test, and for the comparison of the variance comparison, it was the Levine's test, and these are the results that I have here. And the insights from this is that the paired t-test used to compare, yes, the paired t-test is used to compare the means of 2 related groups. And in this case, the baseline and health treatment after A utilized for blood pressure. The extremely low value, the p-value, indicates strong evidence against the null hypothesis. It indicates there is a significant difference in the means of baseline health and health after treatment A for high blood pressure. For the ANOVA test, which is used to determine if there were any statistically significant differences between the means of 3 independent groups, the low p-value suggests there is strong evidence to reject the null hypothesis that all group means are equal. That is to say that there are significant differences in the mean health after treatment A, B, and C. And the Levine test could be used to assess whether the variances of different groups are equal. The higher p-value suggests that there's no significant evidence to reject the null hypothesis of equal variances. In this example, it indicates that the variances of health after treatment A, B, and C are not significantly different. Now, this is the box plot. This is the visualization that I have here for treatment A, treatment B, and treatment C. The Python tools to use to assist with the interpretation would be the uses of the popular libraries, such as NumPy for numerical operations and creating arrays, the SciPy to provide statistical function, the matplotlib.pyplot will allow for creating visualization, and Seaborn to enhance the style and aesthetics of the plot. So this is my presentation, and thank you.